Have you ever wondered whether the loss of sexual desire in middle age and beyond is a natural rule of aging, or a warning sign that the heart, liver, or kidneys may be experiencing problems? This is a sensitive yet extremely important question that affects the quality of life and happiness of many people. Today, we will shed light on a private issue that significantly impacts many lives: the decline in sexual desire. Many people believe this is an inevitable part of aging. However, is every case of decreased libido merely a result of growing older, or could it be a sign of underlying health risks involving the heart, liver, or kidneys? Let's analyze this together to gain a clearer understanding. 1. Age and hormonal changes. As we enter middle age, our bodies undergo many natural changes, and one of them is the quiet decline of sex hormones. In men, testosterone, the key hormone in maintaining desire, erectile function, and energy, gradually decreases over time. This process is slow, but its effects can become more apparent with age. You might notice that the enthusiasm is no longer what it used to be, achieving and maintaining an erection becomes more difficult, or you simply feel less aroused by stimuli that once excited you. Similarly, in women, the decline of estrogen and progesterone during perimenopause and menopause brings about significant changes. Estrogen not only affects desire but also impacts vaginal moisture, often leading to dryness and discomfort during intercourse. Progesterone also plays a vital role in regulating libido and mood. The cooling down of these two hormones can make women feel less interested in intimacy, and may even turn it into a burden rather than a joy. Why is this change often hidden in conversations? Perhaps because we often assume that's just part of getting old. It's seen as a natural law, an inevitable part of aging. The sensitive nature of the topic also makes many people hesitant, unsure of how to start the conversation with their partner, or even ashamed of the changes in their bodies. In addition, some may believe there's nothing that can be done about it, making it seem pointless to bring it up. The silent ripples in relationships. Hormonal changes that reduce libido don't just affect individuals, they can deeply impact marital relationships. The sense of loss, the feeling of something important missing from daily life, can lead to misunderstandings, emotional distance, and even quiet suffering. A partner might feel abandoned, unloved, or no longer attractive. Without communication and understanding, these gaps can grow wider over time. A light at the end of the tunnel, honest advice. However, don't be too quick to think this is a life sentence that cannot be changed. The most important thing is to have open and honest communication with your partner. Talk sincerely about the changes you're going through, your feelings, and your worries. Understanding and empathy from your partner can be a great source of strength. Moreover, consulting a doctor is extremely important. A physician can help you better understand the hormonal changes taking place, assess their impact, and offer guidance or suitable treatment options. Today, there are many treatments and hormone replacement therapies, HRT, that can help improve this condition, depending on each person's health and needs. Don't hesitate to seek support from medical professionals to live a fuller life. Remember, age may bring changes, but it doesn't mean the end of everything. With understanding, openness, and the right support, we can absolutely maintain a healthy and fulfilling sex life at every stage of life. 2. Cardiovascular issues. The heart, the body's tireless engine, plays a crucial role in pumping blood throughout the body, ensuring the survival and function of every cell. When the cardiovascular system encounters even minor problems, it can lead to unexpected consequences in many other areas, including sexual ability and desire. The flow disrupted effects on sexual function. Imagine that for intimacy to unfold fully, a strong and steady blood flow to the sexual organs is required. In men, erection depends entirely on the amount of blood flowing into the corpora cavernosa of the penis. Cardiovascular conditions such as atherosclerosis, where plaque builds up inside blood vessels, narrowing and stiffening the arteries, or high blood pressure, which increases stress on vessel walls, can impair this function. Narrowed blood vessels mean insufficient blood reaches the penis, resulting in difficulty achieving or maintaining an erection. Similarly, in women, blood flow to the pelvic region and vagina plays an important role in natural lubrication and enhancing arousal. Cardiovascular problems can reduce blood flow to this area, causing vaginal dryness, reduced sensitivity, and difficulty achieving orgasm. The troubling silence. Many people may not recognize the direct connection between heart health and sexual life. They may blame age, stress, or other factors, overlooking the heart's warning signs. Sometimes, symptoms of heart disease like fatigue or shortness of breath during exertion are mistakenly seen as signs of aging, causing the real issue to go unnoticed. A lack of knowledge and discomfort discussing sexual matters also contributes to these concerns being buried. When a weak heart affects the flame of love, the negative impacts of cardiovascular problems on sexual life are significant. They affect not only physical ability but also psychological well-being and confidence. Feelings of inadequacy and worry about performance can create a vicious cycle, further lowering desire and causing tension in the relationship. A partner may feel disappointed or question the emotional connection, leading to avoidable strains. A strong heartbeat for passionate love. So what can we do to protect the heart and keep the passion alive in our sexual life? Maintain a healthy lifestyle. This is the most important foundation. A balanced diet rich in vegetables, fruits, whole grains, and low in saturated fats and bad cholesterol is essential. Regular exercise at an appropriate intensity helps improve heart health and blood circulation. Have regular cardiovascular checkups, especially when reaching middle age or having risk factors, family history of heart disease, smoking, obesity, diabetes. Regular heart screenings help detect issues early and allow for timely interventions. Follow your doctor's treatment plan. If you've been diagnosed with a cardiovascular condition, strictly following your doctor's treatment plan is crucial. Good control of heart disease also means better blood flow and sexual function. Discuss medication side effects with your doctor. Some cardiovascular drugs may reduce libido as a side effect. Be open with your doctor so they can adjust dosages or explore alternative options if needed. Remember, a healthy heart is the foundation of a fulfilling life in all aspects, including your sex life. Don't hesitate to start taking care of your heart today. 3. Liver problems. The liver, the body's complex, chemical factory, carries out countless vital functions, from detoxification and protein production to energy storage and, importantly, hormone metabolism. Because of this key role, liver issues can significantly disrupt the balance of sex hormones and directly affect sexual desire. A malfunctioning filter, hormonal imbalances and more. When liver function declines due to conditions like hepatitis, viral, autoimmune, or alcohol-related, cirrhosis, scarring replacing healthy liver cells, or non-alcoholic fatty liver disease, NAFLD, the body's ability to metabolize and regulate hormones becomes impaired. This can lead to imbalances between estrogen, testosterone, and other hormones, causing changes in libido and sexual function. Additionally, liver problems often come with other symptoms such as chronic fatigue, weakness, jaundice, yellowing of skin and eyes, discomfort in the upper right abdomen, poor appetite, and even sleep disturbances. These not only affect overall health but also reduce energy and enthusiasm for all activities, including intimacy. The liver's silence and common misunderstandings. In early stages, liver problems can progress quietly with vague or easily overlooked symptoms. Many people may only feel slightly tired or have a reduced appetite and attribute it to stress or aging. The connection between these symptoms and declining libido often goes unrecognized, delaying diagnosis and treatment of liver diseases. When a weakened liver extinguishes the flame of love. Liver-related effects on sexual life can be quite varied. Hormonal imbalance may directly lower sexual desire. Fatigue and physical weakness leave little energy for intimacy. Other discomforts such as abdominal pain or jaundice can negatively impact mood and self-confidence, decreasing the desire for closeness. Caring for your liver, nurturing the flame of love. To protect your liver and maintain a healthy sexual life, consider the following. Avoid alcohol and liver toxins. Alcohol is one of the liver's main enemies. Minimizing or eliminating alcohol intake helps preserve liver cells. Maintain a healthy diet, eat plenty of vegetables, fruits, whole grains, and limit processed foods, greasy items, and added sugars. This helps the liver function more efficiently and prevents fatty liver. Use medications cautiously. Many drugs can be toxic to the liver. Always consult a doctor before using any medication, including over-the-counter drugs and supplements. Get vaccinated for hepatitis. If you haven't been vaccinated for hepatitis A and B, consider doing so to protect your liver from these serious infections. Schedule regular liver checkups, especially if you have risk factors, family history of liver disease, obesity, diabetes, alcohol use. Periodic liver tests help detect issues early and enable timely treatment. Listen to your body. Don't ignore unusual signs like prolonged fatigue, jaundice, or discomfort in the liver area. See a doctor for diagnosis and appropriate care. A healthy liver not only supports your body's vital functions but also plays a key role in maintaining hormone balance and energy, essential for a fulfilling sex life. Show love to your liver and take good care of it. 4. Kidney problems. The kidneys, the body's remarkable filters, are responsible not only for eliminating waste and maintaining electrolyte balance, but also for regulating and producing certain vital hormones. When kidney function declines, these roles are disrupted, leading to a cascade of effects, including reduced sexual desire. A weakened filter, hormonal imbalance, fatigue, and anemia. When the kidneys fail to function effectively, in acute or chronic kidney failure, waste products accumulate in the bloodstream, leading to symptoms like fatigue, nausea, loss of appetite, swelling, shortness of breath, and especially anemia. The kidneys produce erythropoietin, EPO, a hormone that stimulates red blood cell production in the bone marrow. Reduced EPO levels in kidney disease cause anemia, resulting in tiredness and weakness, sapping the energy and interest required for sexual activity. Kidneys also influence levels of sex hormones. In chronic kidney disease, CKD, hormonal imbalances, including reduced testosterone in men or disrupted estrogen cycles in women, can significantly affect sexual desire and function. The silent work of unsung heroes. Kidney disease often progresses quietly in early stages. Symptoms like fatigue or poor appetite are easily dismissed as stress or aging. Many do not realize the link between declining kidney function and a drop in sexual desire, until symptoms worsen. When weak kidneys extinguish the fire of love. Kidney problems can affect your sex life in many clear and direct ways. Reduced libido, hormonal disruptions can cause a noticeable drop in sexual interest. Fatigue and weakness, toxin buildup and anemia drain the body's energy reserves, leaving little room for intimacy. Physical sexual difficulties, men may experience erectile dysfunction, women may suffer from vaginal dryness or diminished sensation. Psychological burden, living with kidney disease and its symptoms can lead to stress, anxiety, or depression, all of which further suppress sexual desire. Protecting the kidneys, preserving intimacy and well-being. To safeguard your kidneys and maintain a fulfilling sex life, consider the following. Stay hydrated. Drinking adequate water supports optimal kidney filtration. Follow a kidney-friendly diet, reduce salt, animal protein, and processed foods to lessen kidney strain. Manage underlying conditions. Diabetes and hypertension are leading causes of kidney damage. Managing them is essential for kidney health. Avoid overusing painkillers. Some over-the-counter pain medications can harm the kidneys if used excessively. Be cautious with unverified supplements or medications. These may contain harmful substances that can injure your kidneys. Get regular checkups, especially if you're at higher risk due to family history, diabetes, or high blood pressure. Early detection allows for better treatment and prevention of complications. Listen to your body. Symptoms like changes in urination, nighttime urination, swelling, or lower back pain shouldn't be ignored. Consult your doctor. The kidneys play a quiet but critical role in sustaining your overall health and your sex life. Take time to care for these silent heroes and invest in long-term wellness and intimacy. 5. Side effects of medications. In modern life, using medications to treat various health conditions has become commonplace. However, few people realize that alongside their healing benefits, some medications can bring about unwanted side effects, including reduced sexual desire. Though this is a sensitive issue, it can significantly impact many people's quality of life. A double-edged sword: treatment benefits and hidden side effects. Various classes of medications can reduce libido, interfere with arousal, or cause sexual dysfunction. Here are some common examples. Blood pressure medications. Some beta blockers and diuretics may reduce blood flow to the genitals, leading to erectile difficulties in men and decreased sensation in women. Antidepressants, selective serotonin reuptake inhibitors, SSRIs, and other antidepressants can lower sexual desire, make it harder to reach orgasm, and impair erectile function. Antihistamines. Some antihistamines used for allergy treatment can cause vaginal dryness in women and erectile issues in men. Opioid painkillers. Strong pain medications like opioids may lower testosterone levels, resulting in decreased libido and sexual dysfunction. Prostate medications. Certain medications for benign prostatic hyperplasia, BPH, can lead to erectile dysfunction and reduced sexual desire. Chemotherapy drugs. Cancer treatments often cause fatigue, hormonal changes, and diminished libido as part of their side effect profile. Silence, due to embarrassment and lack of awareness. Many individuals may not recognize the connection between their medication use and declining sexual desire. They might attribute changes to aging, stress, or other factors. Moreover, embarrassment about discussing sexual issues with a doctor can create a major barrier. People may feel ashamed or unsure of how to express their concerns. Sometimes, the side effect is not proactively mentioned by the physician, and patients may not think to ask. When a pill unintentionally puts out the fire. Drug-related libido loss can have a significant impact on one's sex life and emotional well-being. It can lead to frustration, anxiety, low self-confidence, and tension within relationships. The inability to enjoy a fulfilling sex life may negatively affect overall quality of life. Open communication, the key to resolving the issue. The most important step in resolving this problem is having an honest conversation with your doctor. Share openly and in detail about any changes in sexual desire or function you've noticed since starting the medication. Your doctor may reassess the necessity of the current medication. There may be alternative treatments with fewer sexual side effects. Adjust the dosage. In some cases, lowering the dose can reduce side effects while maintaining treatment effectiveness. Recommend supportive measures. Your doctor may suggest non-drug strategies or alternative medications to help improve sexual function and desire. Provide better understanding. Learning more about potential side effects can ease your worries and help you cope more positively. Don't hesitate to ask questions or express your concerns to your healthcare provider. Open communication allows you and your doctor to find the best solution, ensuring your treatment remains effective while also preserving your overall quality of life, including your sexual well-being. Remember, complete health includes physical, mental, and sexual health. 6. Other endocrine disorders. The endocrine system is a complex network of glands that produce hormones, serving as chemical messengers that regulate countless vital functions in the body, including growth, metabolism, mood, and reproductive function. When this system malfunctions, leading to hormonal imbalances, it can affect various aspects of health, including sexual desire. Faulty production line, hormonal imbalance and its consequences. In addition to the sex hormones mentioned earlier, other hormones produced by different endocrine glands can also affect libido and sexual function. Here are a few examples. Diabetes. Diabetes mellitus. Diabetes can cause damage to blood vessels and nerves, including those in the genital area. In men, this can lead to erectile dysfunction. In women, it can cause vaginal dryness and reduced sensation. Furthermore, blood sugar imbalances and metabolic issues associated with diabetes can also decrease libido. Thyroid disorders. hyperthyroidism or hypothyroidism. The thyroid gland produces hormones that regulate metabolism. Both hyperthyroidism, overactive thyroid, and hypothyroidism, underactive thyroid, can cause fatigue, mood changes, and affect sexual desire. Hypothyroidism is often associated with a decrease in libido, while hyperthyroidism can cause fluctuating changes in libido. Adrenal gland disorders, adrenal insufficiency or adrenal tumors. The adrenal glands produce hormones such as cortisol and aldosterone, as well as a small amount of sex hormones. Disorders of the adrenal glands can lead to fatigue, weakness, blood pressure changes, and affect sex hormone levels, causing a decrease in libido. Pituitary gland disorders, pituitary tumors. The pituitary gland is the master controller of the endocrine system, regulating the activity of many other glands, including the gonads. Pituitary tumors can cause an overproduction or deficiency of hormones, leading to menstrual irregularities in women, reduced testosterone in men, and affecting libido. Silence of faulty messengers. The symptoms of endocrine disorders can be very diverse and sometimes nonspecific, easily being mistaken for other health issues. Fatigue, weight changes, sleep disturbances, and mood swings may be early signs. The connection between these symptoms and reduced libido is often overlooked until the condition becomes more apparent. When rebellious hormones extinguish the flame of desire. Hormonal imbalances caused by endocrine disorders can affect sexual desire in several ways. Direct changes in sex hormone levels. This directly impacts libido and sexual function. Systemic symptoms, fatigue, weakness, and mood changes can reduce energy and interest in all activities, including sex. Impact on the function of sexual organs, as seen in the blood vessel and nerve damage caused by diabetes. Check and balance, the key to endocrine health and sexual well-being. To maintain endocrine health and a healthy sex life, it's important to have regular general health checkups. This helps detect early signs of endocrine disorders. Inform your doctor about any unusual symptoms. Don't hesitate to share any changes in your body, including changes in libido and sexual function. Follow prescribed treatment plans. If diagnosed with an endocrine disorder, strictly adhering to your doctor's treatment plan is crucial to managing the condition and minimizing its negative impact on health, including sexual life. Maintain a healthy lifestyle. A balanced diet, regular exercise, and stress management can help support the function of the endocrine system. Remember, the endocrine system plays a crucial role in maintaining the balance of the body. Proper management of endocrine disorders not only helps ensure good health but also contributes significantly to maintaining a fulfilling sex life. 7. Psychological factors. Sometimes, the cause of reduced libido does not lie in physical issues but originates from the invisible burdens in our minds. Mental and emotional health play an incredibly important role in igniting and maintaining the flame of sexual life. Clouds in the mind, when emotions affect desire. There are many psychological factors that can negatively impact sexual desire. Stress, pressures from work, family life, finances, etc., can cause the body to produce cortisol, reducing libido and making it difficult to relax and enjoy intimacy. Anxiety, constant worries about work, health, relationships, etc., can dominate the mind, making it hard to focus on positive emotions and sexual desire. Depression, this is a serious mood disorder, often accompanied by a loss of interest in all activities, including sex. Fatigue, sadness, and feelings of hopelessness can completely extinguish desire. Relationship issues, conflicts, misunderstandings, lack of communication, emotional distance, etc., can create significant barriers to connecting with your partner and sparking desire. Body image concerns, dissatisfaction with appearance or weight can make you feel embarrassed, insecure, and avoid intimacy. Past trauma, painful experiences from the past, especially those related to sexual trauma, can leave deep scars that affect the ability to enjoy intimacy. Silence due to difficulty in sharing. Psychological issues are often harder to talk about than physical ones. Many people feel ashamed, fear judgment, or don't know how to express their complex emotions. They tend to bury these clouds inside, quietly enduring and not seeking help. When the mind is uneasy, intimacy becomes difficult. The psychological factors affecting sexual life can be incredibly powerful. Reduced or complete loss of desire, negative emotions can overwhelm all sexual desire. Difficulty achieving arousal, a tense, anxious mind makes it hard to relax and enjoy intimate moments. Impact on connection with your partner, psychological issues can create emotional distance, weakening the bond in the relationship. Decreased self-confidence and feeling unattractive, this can make you avoid intimacy and feel uncomfortable with your body. Nurturing the soul, igniting the flame of love. To protect mental health and maintain a healthy sexual life, pay attention to the following. Share with your partner, be open about your feelings and worries with your partner. Understanding and support from loved ones are incredibly important. Seek help from a mental health professional, if you're dealing with prolonged stress, anxiety, depression, or other psychological issues, don't hesitate to seek help from psychologists or psychiatrists. Therapy can help you address deep-rooted issues and improve mental health. Practice relaxation techniques, yoga, meditation, deep breathing, etc., can help reduce stress and anxiety, creating space for positive emotions to emerge. Spend time for yourself, do things you enjoy, relax, and recharge your energy. Build healthy relationships, spend time with people you love, share, and receive support from them. Focus on the positives, cultivate a habit of positive thinking and appreciating the good things in life. Mental health is the foundation of a happy and fulfilling life. Don't neglect the invisible wounds in your soul. Take care of your mind just as you take care of your body so that the flame of love always burns brightly. 8. Unhealthy lifestyle. Daily habits that seem harmless can silently have a negative impact on overall health, especially on your sexual life. An unscientific lifestyle can lead to physical and mental disorders, which in turn can decrease libido and sexual function. Little things add up, habits that erode desire. Smoking, nicotine and harmful chemicals in cigarettes damage blood vessels, reducing blood flow to the genital organs, leading to erectile dysfunction in men and decreased sensation in women. Smoking also affects hormone levels and decreases overall health. Excessive alcohol consumption, drinking too much alcohol can suppress the central nervous system, reducing libido and the ability to achieve arousal. In the long term, it can also damage the liver, affecting hormone metabolism. Lack of exercise, a sedentary lifestyle leads to overweight and obesity, increasing the risk of cardiovascular diseases, diabetes, and hormone imbalances, all of which can result in decreased libido. Regular exercise improves blood circulation, strengthens heart health, and releases endorphins, which positively affect mood and desire. Unbalanced diet, consuming too much processed food, fast food, sugary items, and saturated fats can lead to weight gain, metabolic disorders, and affect hormones and energy levels. A diet lacking in vitamins and minerals can also negatively impact sexual function. Sleep deprivation. Sleep plays a crucial role in body recovery and hormone regulation. Chronic sleep deprivation can cause fatigue, stress, hormone imbalances, and reduced libido. Substance use. Stimulants may create temporary feelings of excitement but in the long run can cause addiction, destroy physical and mental health, and significantly reduce libido and sexual function. Silence of bad habits. Many people are well aware of the harmful effects of these habits but find it difficult to change. They may procrastinate, make excuses, or not fully realize the negative impact these habits have on their sexual life. Sometimes, these effects happen gradually, making it difficult to notice the direct connection. When an unhealthy lifestyle puts out the fire of love. The impact of an unhealthy lifestyle on sexual life is clear and comprehensive. Reduced blood flow to the genital organs, this causes erectile dysfunction in men and decreased sensation in women. Hormonal imbalances, directly affecting libido and sexual function. Fatigue and lack of energy, reducing interest and the ability to engage in sexual activities. Increased risk of underlying health conditions, cardiovascular diseases, diabetes, etc., all negatively impact sexual life. Affects mood and self-confidence. An unhealthy lifestyle can lead to stress, anxiety, depression, and reduced body confidence. Small changes, big effects, towards a healthy lifestyle and a fulfilling sexual life. To improve your lifestyle and rekindle the fire of love, start with small but sustainable changes. Quit smoking. This is one of the best things you can do for your overall health and sexual life. Limit alcohol consumption. Drink in moderation or, ideally, avoid it. Increase physical activity. Find physical activities you enjoy and do them regularly. Build a balanced diet, prioritize fresh, healthy foods and limit processed foods. Ensure sufficient sleep. Create a habit of sleeping on time and getting enough rest so that your body can recover optimally. Avoid stimulants. Protect your physical and mental health by staying away from addictive substances. Lifestyle changes may not bring immediate results, but in the long run, they will offer significant benefits for both your overall health and sexual life. Invest in healthy habits today to enjoy a fuller, more fulfilling life. Which factor do you feel is most relevant to your situation? Please comment with the number of that factor below so we can share and discuss it together. If you found this video helpful, don't forget to hit the subscribe button and turn on notifications so you won't miss out on more interesting and useful content on my channel. So, we've explored the potential causes of decreased libido, which aren't just related to aging but could also be signs of underlying health issues such as heart, liver, or kidney problems. It's important to listen to our bodies, not hesitate to share, and seek advice from healthcare professionals. Change is absolutely possible if we identify the correct cause and make appropriate adjustments. Remember, maintaining a healthy and fulfilling sexual life is an important part of overall health and happiness. Thank you for watching the video until the end. If you have any questions or comments, don't hesitate to leave them below. Please hit the like button if you found this video helpful and share it with others who may benefit from this information. See you in the next video.